So, Brian, over to you now. The last members of the baby boomer generation, they're now entering that age range where they're going to require more medicine, more personal care, more health checks. Now, we already know that, right, as of now, Medicare might not be sustainable for future generations, but the issue of long-term care is one that not a lot of people are talking about right now. So what can we do from your vantage point to improve long-term care in our country for the people that need it the most?
Yeah, thanks for that question. It's actually Paragon, the think tank that I lead. It's our most recent policy paper is the long-term care problem. And I mean, one of the big problems with long-term care is the way the Medicaid program currently works. It's too easy to get onto Medicaid for people to pay for their long-term care. People expect Medicaid or Medicare to pay for their long-term care expenses. And it really discourages proper planning for individuals when they are young and healthy and can plan for these expenses as they get older. To some of the previous points, I'd say affordability is a big issue. The average premium plus deductible for an ACA plan right now is $25,000. That's unaffordable for the vast majority of people. The only people that buy those plans have to get huge subsidies to purchase them. I think we've got a big problem with our policy where we keep subsidizing inefficiency, and those subsidies just drive up prices and premiums over time. I do think as far as solutions, there are some bipartisan solutions to get at high costs. There's been price transparency efforts. They were started by the Trump administration with rules requiring hospitals and insurers to post price information. They have been continued by the Biden administration. So it's bipartisan efforts to get price information out to help consumers, to help employers as they're shopping for care. I'll mention another positive policy coming out of the Biden administration, over-the-counter hearing aids. It was actually law signed by President Trump, but a regulation recently implemented by the FDA under President Biden. Seniors should have access, people should have access to over-the-counter hearing aids. A lot of people with hearing deficiency, hearing loss haven't gotten the assistance that they need. It's much more costly if you have to go get a prescription to get a hearing aid. People don't do it. Yeah. Having hearing aids over the counter is a really common sense move, and things that we can start doing to, again, expand consumer choice and increase competition in the market to lower prices.